Today we're doing a presentation on the examination techniques of the foot and the ankle. And we're very lucky because Mr. Au has happily volunteered to help us with this presentation. Hello, Mr. Au. I'm Dr. Yo.
Hi.
Okay. So today we're going to have a look at your foot and your ankle. And in a minute, we will position you in place. And then I will talk you through as I do the examination. But do tell me if it causes any discomfort.
Okay,
all right?
Sure.
Okay. Can I just get you to sit back on the couch?
Okay, sure.
Swing your legs across. Okay, so that's great. We want to leave your feet just overhanging the edge of the couch like that. But are you quite comfortable where you are?
Yes,
that's great.
Thank you.
So we shall start shortly.
Okay, sure.
So first of all, we would like to have a look at the feet. And what you are looking out for is any malalignment of the toes. Do look at the nails to see if there are any disease, and also the skin for rashes. Also pay attention to whether there is hallux valgus of the big toes, and also any clawing of the toes and joint swelling. Also look for callus formation. Then you want to come to the undersurface of the feet, also called the plantar surface. And again, you'll be looking out for any skin changes on the soles and also for callus formation. Do take a look at the shoes of the individual because you will want to find out whether there's any asymmetrical wearing of the soles. Look for whether there are any insoles in place and any evidence for inappropriate fit of the shoes. Feel for the temperature over the ankles, the midfoot, and the toes. So do not forget to palpate the pedal pulses. So you want to squeeze across the metatarsal phalangeal joints, but you must always warn the patient that you are about to do that and ask him to tell you if it's uncomfortable. So please do tell me if it becomes sore. So squeeze across the metacarpal phalangeal joint on both sides, so always watching the patient's face. Also palpate over the midtarsal joints and over the ankle joint. And the subtalar joint for any tenderness. So the movements that we can assess at the foot and the ankle consists of inversion and eversion at the subtalar joint. You can ask the patient to turn his feet upwards, which shows you eversion of the subtalar joint, and then to turn his feet inwards, and this shows you inversion at the subtalar joint. So apart from that, if you want to assess the big toe dorsiflexion and plantar flexion, you will similarly ask him to please curl your toes upwards and then to curl them downwards. Then also move your ankles, okay, upwards towards your nose, and this shows you ankle dorsiflexion, and the push downwards, and that's ankle plantar flexion. We should always assess active and passive movements, and therefore I would want to assess the passive movement over the big toe. So I shall move your toe. Do tell me if it's painful. And you want to have the patient quite relaxed so that you are able to move at the joint that you're assessing. Similarly, you can also look at the movement in the midtarsal region, okay, by rotating like so on both sides. And then the movement at the subtalar joint can similarly be assessed by rotating in this manner. Next, with the patient standing, look for toe alignment, hallux valgus of the big toes, and clawing of the toes. Also check the foot for a dropped arch. Ask the patient to stand on tiptoe In a normal person, a dropped arch should correct or resolve with this maneuver. And please, would you turn around? As the patient turns around, you should observe for any abnormality in the hind foot. Look for swelling or thickening of the tendon Achilles, and assess for the normal alignment of the hind foot, which can actually be affected by diseases of the subtalar and ankle joint. And this may lead to varus or valgus deformity. It is also important to assess the gait of the patient. So ask the patient to walk up and down the room so that you can observe the normal cycle of heel strike and toe off. Could you just walk forward for me in a relaxed manner? And turn round. Thank you very much for your help, Mr. Au.
You're welcome.